Well, good afternoon. I'm really excited to be able to bring some folks together with a really inspirational story concerning the use of convalescent plasma to treat folks infected with COVID-19. It's an antibody-rich plasma portion of the blood that is being administered to patients, and we have a great story here about how this is something that has helped save lives. And I think it's something to point out. If you look at what we've been doing in the state of Florida, we are conducting antibody testing at many of our sites. We're doing at least 1,000 tests a day now, we're averaging. And from the 4th of August to the present, every day we've had at least 20% of those testing for antibodies test positive for antibodies. And so that has implications for and it's not scientifically representative of the state per se. These are people that are coming on a first-come, first-served basis. But clearly there's been an increase in the seroprevalence in the state of Florida, and I think that has been probably the major factor in seeing some of the diagnostic testing going down, the percent positivity going down. I mean, for example, yesterday in Miami-Dade at our Miami-Dade Hard Rock site, we did point-of-care diagnostic testing for the virus, and they had a 6% positivity rate on, I think, about 650 of those point-of-care tests. The antibodies have been testing positive at that site at well over 20% for several weeks now. And so, that obviously has implications for the spread or the slowing of it, which is very important. But all those folks who do have the antibodies have an opportunity to help those who are still suffering from the disease, and you can do that by donating your blood. We have hospitals around the state have been using this day in and day out, and I know that we have folks from Ascension here, Dr. Kafrani, and they are doing well with it. They've got a lot of supply, but I think it's always a good thing to be willing to go in and give. So our message is, if you do have these antibodies, well, one, get an antibody test. If you're somebody that thinks you may have come in contact with someone in the past, maybe you think you had an illness in the past that you didn't get diagnosed, go take the test. I recommend, if you're totally asymptomatic, that the antibody test is better to take than a PCR test, because the PCR test, you can't even identify an active infection with that. Whereas an antibody, those are real antibodies if they identify it. So we encourage people to take advantage of what the state's offering. But if you are positive, we absolutely ask you to be willing and consider to donating, your blood, because it can be used. And so today, I think we'll be able to show why this is important. I'm joined by Gail Murray. I'm joined by Gail's daughter, Terry Isaacs. I'm joined by Terry's husband, Steve. And then, as I mentioned, Dr. Kafrani, a pulmonologist and critical care physician from Ascension Health. So they're from Northwest Florida. So Gail, she was treated at Ascension in Northwest Florida, has recently recovered from COVID-19 after receiving her son-in-law's donated plasma. And Gail's story is expiring. It shows how folks, in this case a family, a son-in-law, can help potentially save somebody's life by donating the blood. So it's, I think, a comforting story. You hear a lot about anything that's bad will get a lot of press, but sometimes I think it's worth reflecting on some of the great things that are being done on the medical side, and just also Floridians stepping up to help folks in need. And so we're really happy to have Gail here, to have her daughter and son-in-law are here. So Gail, why don't you introduce yourself? I mean, we had the pleasure of speaking with you. I mean, I think your story is really inspirational, and I think, though, it gives people hope out there who may be in a similar situation, or maybe they know a friend or family member in a similar situation. So,
Absolutely.
So please, the floor is yours.
Okay. Well, when I was in the hospital, I was really sick, and I know that I would not have made it had I not received the plasma from Steve, without a shadow of a doubt. I was so sick that I knew and had pretty much prepared in my mind that, that was the way I was going to go, not being with my family, not being able to see any of them. And then when they gave me the news that they had worked with my doctor at UAB, Ascension had, and they were working together, and it was so much hope, and hope is so important in your life. And it was absolutely life-changing to get that plasma. I have felt so good. I mean, in just a few days, I went from thinking I was going to die to literally feeling, why am I in here? I'm ready to go home now. So please donate. It is so important. It saved my life.
Well, thank you so much. Terry, can you talk about, can you just explain kind of how COVID affected your family from the beginning, because it's an interesting story, and then how the family had to respond, and obviously you were infected and you had to get over it, which wasn't easy either. But if you can tell folks kind of the background that led up to the life-saving donation.
Absolutely. So I became ill the first week in March of this year. And of course, originally at that point in time, COVID was really not something that was affecting our area. And so we just honestly thought I had a sinus infection. I was getting worse. Then I was diagnosed as having possibly bronchitis. And then the next day I had gotten so progressively worse that it ended up in at the hospital. And I was the first person at the Sacred Heart Ascension on the Emerald Coast to be tested for COVID. And so I was in the hospital for 10 days. And during that time period where I was in the hospital for 10 days, my husband and my mother both began running fevers and started their COVID journey, so to speak. And my husband and I were both in the hospital at the same time, and we were on the same quarantine ward, but in separate rooms. And I got out on a Sunday, he got out on a Tuesday. And then at that point in time, my mom was still running her fever, and so the day after Easter, she ended up in the hospital for 11 days. And so it was one of those things where my siblings and I had really had to come to terms with the fact that this may not be something she would survive, with the fact that she has leukemia and such an incredibly compromised immune system. And she just wasn't fighting it at that point in time. She was running 104 fevers, and her oncologist was extremely concerned, and he stayed very, very involved in the process. And it was by his suggestion, in working with a Sacred Heart, to go with the convalescent plasma. It was still kind of new at that time for our area. In fact, we were the first ones to do that, and the first ones to donate at the One Blood bus in Panama City. So she received the plasma at 7 o'clock in the morning on a Sunday, and by Tuesday she was fever-free, and by Thursday we were picking her up to come home. And it is crazy when we think back about the fact that on Sunday and Monday, the siblings and myself were having to come to grasp in reality that she may not actually make it. So it was a journey.
Well, Steve, you were the one that made the donation. So you talk about how that came about, and I know that it was a very consequential thing. So thanks for doing it.
Yeah, thank you. It really was, and I mentioned it was so new, talking about the convalescent plasma, and we had to get tested. I really didn't even know what my blood type was, but I ended up having what they called it golden blood. I'm O negative, so I can help. I can help anybody with my blood. So I was excited to be able to go and help. And with the plasma donation, you know, I was able to dedicate one portion of it to my mother-in-law, and the other two went to somebody else. So I'm hoping they did well with it too. But you know, we kind of joke. I've got a sweet tooth, bad sweet tooth, and after my mother-in-law, she said, "I crave sweets." I said, "Well, you probably got that from me." But, it was yeah, I was excited to do it, and given a chance to do it again, I'll do it as many times as I can.
So what was it like? So, you know, you donated the blood, obviously, then they administer the treatment, and then you guys just sitting there hoping and praying that it kicks in, or were you getting updates? What was that time period? Because I know the resolution, I mean, it happened pretty quickly, but it was still, what, a couple days probably before it did? So what was that like?
Yeah, so again, it was so new that, you know, we didn't know really what to expect, but to find out how she started getting better almost immediately. We knew it was something that was going to be big for the treatment of COVID, and we were again glad to be a part of that early process.
Great. Well, thank you for stepping up. Dr. Kafani, can you just talk about some of the evolution of the treatments, of how you guys have handled this? But then also, if somebody is infected with COVID, at what point is the blood, because I know the IgM antibodies, then the IgG, but it takes a little bit of time. But if they give right at the outset, is it the same effect, or do they have to wait for the antibodies to more fully develop?
As far as the treatment, I mean, it's interesting that at that point in time, we did not have a lot of treatment. So that was one of the very few things that we could do. And it's awesome that it does work for some people. So this is a great story. As far as when to get it or when to give it, as soon as the person is PCR negative, then by then they have the antibody to have fought the infection, so they should be able to give it. So you don't have to wait a certain period of time. As long as you're not giving the infection with the antibody, you should be okay to just give blood to be able to give the antibody.
Do we know the response is obviously very positive in some cases? In some cases, you know, you don't really see improvement in patients. Do we have understandings as to why that may be?
We do not. We're actually still waiting for the data because the data is still being collected. The FDA just sent a memorandum as far as like the safety of it, but we don't have the conclusion as far as who gets better and who doesn't. But what we do know, what we seem to find out from practice is that it seems to work for earlier rather than later, like the earlier in the course that you give it. And it seems like it does, when it does work, it works pretty fast. You see the effect pretty fast, but that's still anecdotal. This still has to be proven.
So if somebody's admitted to the hospital for COVID, would you immediately move to convalescent plasma, or would that be once they reached a more critical stage?
Yeah, if we believe that they're trending the wrong direction, then we directly move into giving them the plasma. That is correct.
And that's even before admission to like the ICU?
Yes, that is correct.
Good.
Yeah, I mean, as long as they're trending in the wrong direction and things are not, I mean, they seem to be getting worse. Like I said earlier, I mean, the earlier the better to give it. So that's basically what we do now. Now, are we going to be doing that in a month? We don't know. The more data we get, the more we know about this disease. It's changing on a daily basis.
Right. And your hospital census, what was your peak for COVID positive? Sometime in the middle of July, third week of July?
Yeah, probably around 3 weeks ago.
Yeah. And you've seen pretty consistent downward trend in admissions?
It's been pretty consistent, and now we're seeing the downtrend in the ICU, which usually lags a little bit behind.
Good.
Well, first of all, I have to say, Steve, you set the gold standard for a son-in-law, so I don't think you can top that, but I think your story is phenomenal in the sense that your family all rallied around each other and that you donated. And, you know, one of the things that I see a lot of, and just watching a lot of the roundtables from a distance or speaking with parents of students, you know, a lot of students are very concerned, you know, what does this mean for my future? They're having a hard time processing what is going on, and I think one of the things that your story really illuminates to so many people is just that of hope. You know, we should never give up hope. We should always look forward to this won't define us. We'll be bigger and better and stronger for it. And I think your family sitting here, talking about it really embodies that. So, Tara, I know that's very, very, very much true. Gail, I'm sorry. Tell us a little bit, though, about how this makes you feel to be here, to share this.
Well, I feel very proud in some respect. At the time, it was devastating to everyone, and to share a happy story that I made it through was just, I mean, it is just the most incredible feeling to know that I've gone from really feeling that I wasn't going to make it to, in just a few days, feeling great. I'm ready to go home. And it gave everybody, you know, such a high, such hope. You know, it was just unbelievable. And Terry also donated her plasma and was able to save someone in Pensacola.
Talk about that.
So the day that we determined that Steve was a perfect match for my mom, one, because he was actually not a family member and he had the O-negative blood, they went ahead. I knew my blood type already, and through the coordination with Sacred Heart, I received a phone call the same day that he was going to donate his plasma, and they asked if I would be willing to donate mine, that there was a gentleman in Pensacola that was in ICU on a ventilator that I was a match for. And so, of course, without hesitation, I went and donated that same day, that afternoon, to the One Blood bus in Panama City. And from what I understand, the gentleman did make it. And so it's a great story.
Can you talk about how how you got infected? I think you had told us that before.
Yeah, you know, there's always that you wonder where it was that you may have gotten it. And for the longest time, we thought we had our thumb on it because we had returned from Key West mid-February, right where the cruise lines and that sort of thing were. And so to us, it made perfect sense because, truthfully, other than that, we don't run around, you know, the country a lot. Once we got home, we were at home or with family or at work, and so our exposure was fairly limited until I realized the other day that there was a gentleman that is a New Yorker that I had come in contact with. I realized that I'd come in contact with him in February towards the end, and realized as I've gone through the process that he was sick the entire month of March with COVID. And so the suspicions are that that's where I came in contact, and it was literally over coffee at a Starbucks. So that's how quick and fast and innocent that you can get this virus. It's very contagious.
How are you doing overall with your health, just apart from the recovery from COVID?
I feel great. I really do. One of the things I wanted to say, too, about donating your blood, if I may.
Sure.
I have to get IVIGs every 3 weeks, and there's not a time that I don't walk away from that hospital thinking, thank God to those that donate, because my immune system does not produce any immunity anymore, so thank God for that. But the fact that I was so near death, and to have this help again through blood is just unbelievable. And so I really, all of you that donate blood, yay.
Well, and I'll say this, too, about the convalescent plasma donation, and I know a lot of people don't necessarily understand what all is entailed, and literally, my process was 45 minutes. They pull the blood out, they cycle it through a machine, and then they put the rest of it back into your system, and they withhold the plasma. And it's it's gold. It's literally, it is a bag of gold. And, you know, the fact that the irony is not missed, the fact that it looks like a bag of gold, and that's what you're using to save people's lives, and that's where the hope comes from.
You know, I think people often wonder, what can they do to help make a difference? And, you know, they're thinking to themselves as they're watching this, and this is one example, just to go in to give blood. It's good to give blood regardless.
Yes.
It is,
That's always
yes.
something that we need. You know, God forbid somebody needs it, but at the same time, if you have those antibodies and you can make a
Yes.
difference, I mean, you've saved a life. Son-in-law of the year has saved a life. You know, there's just wonderful things that you can do to make a difference for our fellow man. I think it's exquisite. So, and thank you for taking the time to even
Thank
come
you.
here today to do that.
Thank you, because it's important that people know this.
Yeah, no, absolutely. And we do have antibody testing available at our drive-through test sites, and so people should avail themselves of that. It's also something where if you're somebody who, for example, I mean, we have people that work at nursing homes and long-term care facilities, and them, when they have positive antibodies, you know, that is a good thing in terms of the protection that we see and the ability to interrupt transmission. And then in other key critical areas, it's really important to have that understanding. And so we want to offer it. It also helps us just to see how that's progressing. When we started doing antibody testing in May, we did first responders and healthcare workers, and then we opened it up to the general public, I believe, sometime in July. And, you know, basically we've seen a consistent increase in positives for antibodies. So there's a lot of folks out there compared to probably where they were in March in terms of Florida who has the ability to give. So we'd absolutely recommend that you give. How, Doctor, I mean, how would you characterize all the various treatments that have been tried? I mean, I know sometimes you'll do them in conjunction, but I know we talk about the convalescent plasma, you talk about the remdesivir. We've worked to get the hospitals as much of that as we could. I know they're using, you know, some of the steroids, and there's been other things tried. Is it more like altogether more effective, or do you think one or the other has shown to be effective, just in your experience at Sacred Heart and Ascension?
Right now, what we're doing is giving all of it.
Okay.
So, because we know the things that work or it seems to be the steroid and the remdesivir. There's still some other stuff that's in trials that we can do, and the convalescent plasma. So usually for somebody who's getting sick or not turning around pretty quickly, they usually get Decadron, they get remdesivir, and they get convalescent plasma.
And the remdesivir started.
Plus or minus
It
other
started.
drugs.
It started in June. You started doing. When did you get your first? We sent it in June.
I think June is.
Yeah, I think so.
When we started.
Have you noticed? So when you only were doing convalescent plasma, and then you started to add the steroid and the remdesivir, has there been better outcomes than when you only had convalescent plasma, or do you think it's been pretty similar?
Subjectively, I would say yes. I mean, it seems like we know a little bit more about the virus now, and the people are getting better a little bit more than when we first started. I think it just comes with experience with this virus, because when we first started, we knew nothing about it, and now we do know a little bit. Now, over the next few months, we'll probably learn a whole lot more. So it's just a matter of time to hopefully conquer that thing.
Sure. Steve, any parting words of wisdom?
Well, I guess if I could just say anything, it would be just to give. It's an unselfish way to help others, not only with this COVID, but giving blood is needed. And so I guess my parting word would be to give.
Yeah. Well, thank you for giving. I know that's meant a lot. And Gail, thanks for making the trip over. I think
My pleasure.
you know, hope is important, and
Hope is
people need to
very
know that there's hope out there. And I think that this whole experience, as tough as it was, I think is, you know, inspirational for other people. So we really appreciate it, and thank you guys so much. I think that this will help increase donations of people. You know, not everyone even knows about convalescent plasma.
Right.
We've talked about it. We try to get the message out, but, you know, people are busy. They got other irons in the fire. And so maybe this resonates and people decide, you know, to come do that. Thank the First Lady, too, for all she's done. not only for this, but for particularly things like mental health, which are kind of an offshoot of what happens when you have something like this going through the communities. We're going to be talking more about that tomorrow. I will say that I appreciate the efforts of Floridians over these last many weeks. I think that the trends in the state of Florida have been positive now for the last several weeks. As we mentioned, the COVID positive hospitals census has been declining for about the last 3 weeks, consistent with what we've seen in Northwest Florida. And I think it's down over 30% from the peak, which was probably around the 21st or 22nd of July. That is a trend that was likely indicated by the significant decline we've seen in Floridians going to the emergency department for COVID-like illness. We look at all this data and we try to make sense of it. I think we saw yesterday with some of the test results, you got to take and really dig underneath those test results to really make a determination about whether a particular day's test results are offering us a good indication of the facts on the ground or actual trends. We had a new private lab that had kind of just come online in June submit 7 weeks worth of results from testing in southern Florida. And so they had 14,000 results that were basically dumped yesterday. And many of the, quote, cases were from the end of June and the beginning of July. And so you'll look at that. If you didn't know that, you would think, oh, man, Miami-Dade, they have all these new cases. Actually, those are old cases. The trend is still positive. And today's report, shows the trend in terms of the positivity is lower in Dade than it was 2 weeks ago, and it's continued to go down. But so you look at that, you got to kind of make sense of it. But those COVID-like illness visits, we're seeing those decline all across the Sun Belt. Started to go up in the middle of June, peaked in the beginning part of July, that maybe the end of that first week, beginning of the second week of July, and then it's just steadily been declining ever since. That is probably the best indicator that we have, because that's real-time, accurate data of people coming in and either being admitted or not based on COVID-like illness. So when you see that decline, you're going to then see the hospital admissions decline, and fortunately, the mortality will decline from there. So that's been the best trend to watch, and that's the trend that we're going to keep looking at. I've told the Department of Health on these test results, we want fresh data. I think that we need to get that done. At the same time, I've also just cautioned people that if you're making decisions at a local level about some of this stuff, just be careful. You got to remain a little bit flexible and to tie it to some of the data and have, say, a kid's future about whether a parent can send a child to school be tied to some private lab that dumps tests 7 weeks late. That may not be the best way forward. So just there's scrutiny that's required, and we look at it every day to try to understand. You also have some other parts of Florida, some more rural areas that may have increased positivity because you have prisoners tested or something like that, which is, that's an important issue in of itself. But that's not something that's really reflective of the overall community. So I think all those things need to be put in their proper context. But that said, the trends have continued to be positive. I had a number of conversations with CEOs of some of the major hospitals throughout the various regions in the state of Florida. We talked to Tom from Ascension. We talked to David Strong from Orlando Health, John Corris from Tampa General, and Carlos Magoya from Jackson. And they all report the same results that we're seeing, the same positive trends. Carlos told me that Jackson, which is probably the number one system that was really hit when Miami was really increasing, they're down 40% with their COVID positive patients, and I think he said about 25% in the ICU, and I think we're seeing that throughout Dade County, which is obviously a very, very good sign. So the hope of this individual story and to give is really paramount, but I do think people can look at the overall dynamics and feel cautiously optimistic about the the direction that the state is going. So we're going to keep working hard. One goal, one Florida. People have been doing their part, and I think it's made a big difference. So thank you very much. I appreciate you guys coming, and if there's anything we can do, please let us know. And with that, if anyone has any questions for me or anybody else, we're happy to take it. Farrington?
Question for Gail.
Yes.
Obviously, you felt like this disease, you could have succumbed to it without the help of another. Thousands of other Floridians have not been as lucky, and in fact, we had a record high number of daily deaths. Your daughter, within the past week, your daughter mentioned that she may have picked it up at Starbucks. So all that considered, how would you rate the way the state has handled the reopening? And would you like to have seen anything done differently?
Honestly, I think the state of Florida is doing a fantastic program with how they're handling it. The hospital that I was in and working with the other hospital in Alabama was absolutely unbelievable. I mean, I'm here to say that it was just a really nice it's good to say I'm alive and well and doing great. So I think the state of Florida and, these doctors that I had were just amazing, fantastic. And
let me just point out, when you get reports, of fatalities, it's obviously a tough thing because in every one of those instances, you have somebody who, may have been in Gail's shoes, but didn't quite. Maybe the plasma didn't work, or maybe it wasn't given in time, or maybe it's just they had other conditions that made it difficult. And so you have family members who lose a loved one, and not only that. We've had isolation in different hospitals. Now, I've encouraged hospitals, particularly in end-of-life situations, to allow that personal contact. We're working on getting long-term care facilities residents to be able to have some contact with their families because the emotional toll is very significant. So these things are all very, very tough. But at the same time, I think that the picture needs to be accurate. There's not a record number in terms of the days. These are reports from weeks in the past. And I think if you look at how those are in terms of each day that those occur, you look at our highest was July 16th. Now that could change, but to act like it's accelerating when, if you look at when it's actually occurring, it does paint a different picture. So I think it's important to just characterize that accurately. I know that probably won't be as flashy in terms of a headline. But I think that that's more of an accurate. Well, not only it is more accurate, it's the accurate way to do it. So we are looking at those trends, but I think if you're going to do it, you really got to look at when it's occurring, not when it's reported. We'll have people that'll report these things. Some of these medical examiners that'll just kind of pile up and do it. And so I think it could present a picture to folks that that trends are occurring that may not be. So knock on wood, I think that there's been a lot of great stuff that's been going on with the physicians. I think as tough as July was in terms of witnessing the mortality, you also saw a lot of recoveries in July, and I think that's a testament to some of the work that our medical folks are doing, and we really appreciate that very much. And hospitalizations are down, still have people there. And that's all. Every one of those folks is very important, and we pray for the best possible outcomes. But I do think that you're probably going to see better outcomes with folks hospitalized today than we would have 4 or 5 months ago, because I think people are learning more about it every day.
The decrease in overall tests over the last month or so, and then what you mentioned fixing the delay in results. What exactly are there going to be penalties for these private labs? How are you going to fix that?
So the way these test results get reported, just so people understand, there's, all these private labs. Every hospital, a lot of the hospitals have their own labs. You have major labs like LabCorp and some of those, but now you have a proliferation of smaller ones. And this one in Miami is kind of a new one. They have their own test. And they're kind of getting in the game, trying to go test business, go into businesses, test employees, all this other stuff. It's their responsibility when those results are received to place it into the state's system. It's called Merlin. And under law, you're required to report those results, every positive, and then our executive order says you report the negatives as well. Well, obviously, that didn't happen this time. I mean, I told the Department of Health that there should be consequences to that. Because of the fact that some of these results are being used to affect people's lives in a public policy sense. Now, I'm trying to urge some caution on that because this is just the nature of it. But here's the issue. No one knew this lab was even doing these. I mean, it wasn't, well, actually, I take that back. There was, they were contracted with people, so people knew that testing was happening. But like the Department of Health, you know, if they go do 100 tests at a workplace, they don't know that that's occurring until that's put in the system. So, but there needs to be some consequences for that, because I think skewing data by letting it accumulate and then dumping it, I think leaves a bad impression. But that's also a reason why I have been consistently now for several weeks talking about looking at that COVID-like illness visits to the emergency department as being really the leading indicator in the prevalence or the resurgence of the virus. And I think we're seeing similar trends throughout the Sun Belt as some states like Arizona started rising a little bit for us. They've fallen a little bit quicker than us, but we're kind of following behind them. And then some other states, Georgia, started going up a little bit behind us, so they're kind of behind us. But I think that is kind of the indicator that you really look at, and really is what makes the most sense. I mean, we now know with these PCR tests, you can test, if you're asymptomatic and you go in and you test positive, they cannot tell you whether that's a live virus or not, because you can test positive for weeks and weeks. CDC says up to 12 weeks, but we know people, it happens all the time where they'll test positive for 30 days or 35 days or something like that. And so the result is, if you test positive, which we had a lot of people doing in July, particularly in the 20 to 30-year-old who were asymptomatic, whether they are carrying an active infection or not is not something that PCR test can tell you. Well, if somebody's showing up to this ED with COVID-like illness and they test positive, yes, at that point you're going to know, that they have an active infection. Just the fact that they're showing up. Now, they may be negative for COVID, but the fact that they have symptoms and they're showing up, that is really significant. So I think you look at the COVID-like illness as the most important indicator, and I think you've seen fewer positive tests come in over the last couple weeks. I think part of that is because of the increasing seroprevalence that we see throughout the state of Florida. I mean, when you look at different cycles of this that's occurred in other parts of the world, other parts of the country, that does reduce the reproduction rate of the virus. And so when I'm looking at those test results, as I see the antibody positives go up, you can chart it. As that goes up, the PCR positives have gone down, and I do think that there's a relationship there.
The number of tests, why have we seen fewer and fewer tests for the last month or so?
I mean, we compare us to like Texas, which is bigger than us. I mean, we're testing between 60 and 100,000 results come in a day. That's a lot of tests. I mean, that's a massive amount. When we had 144,000, that was a huge dump. But we're testing a lot. I think part of the reason why some of our sites aren't doing as much is because people aren't going as much as they used to. I mean, if you look at like the Orange County Convention Center, the beginning of July, we were having 2,000 people show up to get PCR tested there. Now we're 700 are going. And so I think the demand has ebbed, but we're still doing a lot of tests. I mean, to have, I think Texas, the most they've had in a day is 60,000. 60,000 is like a low day for us. I mean, we're usually 80, 90,000, which is way more than I initially forecast we were going to do back in May.
Can you clarify for me what you met last night when you talked about the Navy SEAL raid? Was it about danger? Was it about
No.
courage?
So the superintendent had McRaven interviewed, and she basically told them, hey, this is what they're doing. They had a mission, and they just had to figure out a way to accomplish it. So here we are. We have a mission to provide these options to our students, and we're gonna approach it in the same way. We're gonna make sure that the parents who want the virtual have it, who want in-person have it. We know that it's a challenging time. There's obstacles, but we're going to overcome the obstacles. So I think it was more about inspiration and about figuring out a way to get it done than anything about comparing the danger to that. I mean, obviously that's a much different situation.
Governor, as of today, 14,000 inmates have tested positive, 2,000 workers have also tested positive, 75 inmates have died, and 2 workers have died of COVID. What specific and additional measures is your administration taking to ensure that, to prevent further infections?
Well, we're going to, in the prisons, I think after this week, I mean, we're going to have tested, I think almost every prisoner, the huge majority of the prisoners. I know they've gone through, all of them and do it. We have had some prisoners who, particularly some of the ones that were very elderly with health conditions, end up hospitalized. We have lost some folks. You have the vast majority of the prisoners that test positive are completely asymptomatic, overwhelming majority that are. So they're going to continue going through the testing regime, but I think the main thing is just isolating the folks who are symptomatic and likely to be spreading it, and I know they've worked hard to do that.
Is there a task force? I want to ask you, there's been some felon voting rights groups who are frustrated because they say some new guidance from the state was quietly posted online, and they're curious why that was, because they obviously depend on that information to go register to vote.
So say it again. I'm sorry. I haven't heard their complaints.
No, that's okay. There's some felon voting rights groups who are frustrated because there was some new information, new guidance on how to vote if you're a felon or a former felon in the state of Florida that was quietly posted to the Secretary of State's website over the last couple of days. And there hasn't been any major announcement about it, and it details some of the rules and regulations that former felons would have to go through. And they've been looking for this guidance since the new law went into place. So they're curious why it wasn't more publicly announced.
I'm not sure, to be honest. I mean, I think, as you know, there's pending litigation in that matter. So you have an appeal that is going to be litigated before the entire 11th Circuit Court of Appeals. That court has entered a stay into the federal district judge's order, halting that decision from a few months ago. And so I think that this will all come to a head pretty soon. I think we're gonna have very clear guidance, probably within the. I think they're doing some arguments or that's scheduled, or I know they filed briefs. So all this stuff is going to come to a head, and I'm sure they're going to provide appropriate guidance at that time. But obviously we're. We've got a lot of irons in the fire generally, so there's a lot of things going on. Yes, sir.
It looks like there was an increase in nursing home deaths from July 24th to August 8th, which is Saturday. I calculated a 32% increase, went up by 801 people that died. You just said obviously there's a bit of a lag in this data, so that's not, we're not staring at the face, we're not staring at the face of doom right now. But I guess, what's your prediction for the folks living in long-term care facilities? What are things looking like now? What are you seeing on the
So yeah, no, I think what we've seen is you saw some significant outbreaks in some certain areas. So, for example, in Jackson County, you had 50 workers test positive, all asymptomatic, but that got in. I mean, it's a county-run facility. You did have hundreds of residents, but that is already in and of itself, I think, led to 35 fatalities from that one instance. And it's a tough thing because there's different procedures and stuff. But if you really truly don't have symptoms, the only way that we could potentially identify that is either through a test. But even then, how active that infection is, and then obviously once the residents develop symptoms. And so that's what happened there. That's really, really unfortunate. I think that the concern I have is, and I've asked Health and ACA to say, I said, what are there other resources we can provide? We've been providing PPE. We have no request for PPE, but we really believe when the workers are doing that it does mitigate and does make a difference. And so I asked them, survey them again If we need to send more masks or gloves or gowns, we want to do that and then obviously we're continuing doing our testing with the staff. So they get tested every 2 weeks, and this is over 200,000 people throughout the state of Florida. And so what you have is, fortunately, the positivity rate on that has declined just like the state. It was never as high as the state. I think we got to maybe 3.5% or 4%, but still in nursing home environment, that's very, I mean, just having somebody in the general public is going to be less dangerous than having someone in contact with the most vulnerable residents. And so it's definitely something, but we're seeing a decline in that. So we think that's running about 2% now, which is good. But if there's anything that we can do beyond that, I want to. And the reason is I kind of fear that if the fatalities in the general public get on a downward trend, that you could see a tail kind of at the long-term care, because it may take a little longer to get into those facilities because we have mitigation measures, all this other stuff. But I think as we know that when it does get in, it becomes problematic. So we also have infection control teams that are going back and visiting these facilities again. It's amazing if you look at where we're at now with it, which just is a good sign. And you go back a month, the number of facilities that had 10 or more infections between either staff or residents, was kind of right here, and it's dropped dramatically. And so that, I think, is testament to the fact that, one, the prevalence in the community has gone down, the staff prevalence has gone down, but then some of the mitigation measures may have had an impact. Nationwide, we're probably running 50% of all of the COVID-related deaths from residents in long-term care facilities. Now, in Florida, nursing homes, assisted living, I mean, we have a broad definition of that. Some other states have a more narrow definition, but it is probably the number one most vulnerable place. Now, the federal government's sending point-of-care testing to, I think, about 5,000 nursing homes. So obviously we have over 4,000 facilities in Florida, so that's not going to be enough for us. But you are going to have some point of care testing. But I think one of the things that we're cautioning people on is, doing mitigation and really doing the PPE, making sure that, people aren't going into the facilities who shouldn't be there, all this. That really is, in some ways, more effective than the testing. Because the testing is, how often can you realistically test people? I can go in and test a nursing home today. I could get 100% negatives. Well, guess what? If you're not doing the mitigation with the staff and making sure that people are screened properly, you could end up with an outbreak in 2 days, and then you end up, having to deal with a really significant problem. I will say one of the things that's been very helpful at mitigating these outbreaks has been our COVID-only nursing facilities that the state has worked with hospitals and private and providers to stand up over these last many months. When you're going into a nursing home, if you have, say, 2 residents test positive, everyone negative, they need to be isolated. Most facilities can't appropriately isolate them, so you do have an opportunity to transfer them to the COVID-only nursing units. Now, some may require hospitalization, and obviously you would do that. And then if they recover in the hospital, you can discharge to the COVID-only without them having had to clear the illness yet, because they're not in danger of infecting other people. And of course, we've prohibited a hospital from discharging a COVID positive back to a traditional nursing home from the very beginning. So I think those have been very helpful, and I think it's taken some pressure off the traditional long-term care facilities who, it's very difficult with this thing, because when it gets in, I mean, it can spread very, very quickly. And if you can't get a handle on it, then you end up in a really significant situation. So this allows for that appropriate isolation, and I think it's been something that's been effective. But I'm concerned over the next couple weeks, I'm concerned of seeing kind of a tail where we start to see some of these long-term care deaths. If you look in March and April, we peaked on COVID-related deaths for the general public sometime like the second week of April. And those just started going down. But then what happened was the LTCs just kind of kept going. And I think it was because you did have a lag. It took a little longer for the infections to get in. Now, we have a lot of controls in place, and we're working hard on mitigation. But when you have 4,000 plus facilities, particularly some facilities in some of the areas that have traditionally had high prevalence here, it's definitely a challenge.
Follow up on prisons. Considering all the measures you just enumerated for nursing homes, where there's similarly a contained environment, would you consider enacting some of those same measures for prisons, be it COVID-only wings or a facility with people that have already tested positive or something like that? Like what other specific measures comparable to nursing homes, a task force, might you consider in prisons?
Well, I think obviously when you're talking about a prison, you're talking about a different. There's a much more challenging situation that you're dealing with in terms of finding alternative facilities. I mean, they have isolated, within the existing framework, that they have, and we've obviously encouraged them to do it. I mean, one of the things that I think we've learned is you have so many asymptomatic people, you don't know whether those infections are even accurate. If you really focus on isolating symptomatic COVID positive folks and really do a good job with that, I'm not sure that some of the asymptomatic cases we're getting, by the time they test positive, I'm not sure they're even infectious at that point. And so focusing on that, I think, is something that's really important. We've dedicated a lot of testing resources to the prisons, and probably have tested not quite as robustly as the nursing homes, but I mean, nursing homes have been the most robust target for us in terms of testing. I would say probably the prisons have been second, just in terms of the amount of resources that have been done. And we've gone through, I think, pretty much all the facilities at this point.
Chevron Jones recently tried to donate plasma, but he was denied because of his sexual orientation and sexual activity. That is an FDA rule. But do you believe that the FDA should repeal that regulation, and should Representative Jones have been able to donate his plasma?
I wasn't aware of the regulation, so I'd have to research it.
Governor, what would you say to the Florida Education Association, which was in court today trying to keep schools from opening?
Well, what I would say is, my view on this has been, parents. This has been a very difficult time for parents. You're in the school year, kind of the second part of the school year, and then all of a sudden, it seems like time stands still. Kids are out, and your world's now been turned upside down. And there's some parents that probably handle that no problem because of their circumstances. There's others where, man, that is a real struggle, particularly when you have a single parent that has to put food on the table for people. And so I looked at that and said, these parents really need to have an option for their child. If they want to have distance learning and maintain that, then I think they should absolutely be able to do that. I don't think we should tell a parent you got to send them to brick and mortar if they're not comfortable doing it. But I also know there are a lot of parents out there who really do want to see in-person instruction again, because if you look at one, it just makes it easier on the families, but the interest of the student, there's just no way you can say that the distance learning is the same as getting that in-person instruction. And that's in a variety of contexts. I mean, we've talked about special needs students. I mean, I had teachers in Pinellas County at one of the schools there talk about how we need our kids back in. You can't do this effectively online, particularly in a special needs context. We also know the academic gap that develops when you don't have that in-person instruction. And we've had a long delay, and to do it even more when some of the kids really need it, I think is significant. And then as the First Lady always reminds me, the teachers are more than just there for academics. I mean, they're really they're looking after the health, safety, and welfare of their students. They're some of the first lines of defense when it comes to identifying abuse and neglect. And I think the proof's in the pudding on that when you've seen how the calls declined when the schools were virtual. So I think all those things really counsel in favor of having this choice. I think the districts, by and large, have approached it very intelligently. But I also have said that in any avenue, not just education. I mean, if you're a government employee in the state, if you work for a private business, anyone who would be in a vulnerable category in terms of COVID, should have accommodations made. And I've even said if there's teachers that just don't feel comfortable, even if they're not in that environment, make accommodations for them, to want to do distance. What you're going to find is there's going to be a certain number of parents that are going to choose in person, certain will choose distance, and so there's going to be teachers that are going to need to be there for the distance in addition to in person. So I think that just having maximum flexibility makes the most sense. I've been able to talk to some superintendents. Martin, I think they were about 60 to 65% of the parents chose in person to start, but superintendent tells me she thinks now some of the parents who chose virtual to start now are looking and saying, hey, we'd like to get back as well. So they anticipate that number to rise. I talked to the superintendent of Baker County. They have 93% of the parents have opted for in-person instruction. And I mentioned yesterday in my when I made some comments about Suwannee superintendent saying he's never seen a first day of school like this, where you had parents just bringing gifts, bringing all kinds of supplies like sanitizer and all this other stuff, that it was just a sense of relief to be able to get to some semblance of normalcy. So, I think that the safety is very important. I know everybody in all these districts are really working hard at ensuring a good, healthy environment. But I have no doubt also that, we kind of talked about it a little bit with the athletes and the college sports about, that's the best environment for them. Just in terms of coronavirus, forget about all the other things. Just in that structured environment, they're going to do better there. And I kind of feel, similar with some of our kids being able to be in school. That's a nice structured environment. You have folks that really care about their health, safety, and well-being. And if you don't have the option for that, there's no telling what risk those kids will be exposed to. So I think it's really important, but I also think that the flexibility is very important, doing whatever you can for safety, making accommodations for teachers. But I'll tell you, I know unions have certain thing and they represent, some, but they don't represent all. Certainly the sentiment on this, the excitement of a lot of the teachers from talking to the superintendent was really something that I found very powerful, because I think, when you go into this, you're going into it knowing that you have an opportunity to really shape the lives of some of these young people, and then to have that kind of taken back where you're just doing it through a computer screen, I think people realize that it's just not the same, and that to be able to get back and do that personal touch again, will make difference in people's lives. So I think the districts that have done what they've done have done it very thoughtfully. I know we got more that are going to be coming online soon, and again, we're just going to support parents making the best choice that they think is right for their kids. Thanks, everybody.
Player tested positive. Does that give you pause with your push?